Take you to KZN now, where patients needing surgery at the Dr. Pixley Ga Isagaseme Memorial Hospital in KwaMashu have been dealt a heavy blow. In fact, many of them have had to have operations postponed because staff shortages are a real thing there. Over 100 staff at the hospital are on strike. Their grievances range from poor working conditions, security and non-payment of overtime worked. Lethiwe Mdluli has been following this story for us, and she joins us live right now. What is the latest that you can share with us, Lethiwe, right now?
Well, earlier on when we were at the hospital, we got a chance to speak to some of the workers that were picketing outside the hospital, and they did share their grievances, which are many. Some include the fact that there's understaffing at the hospital, and they've been raising this issue with the departments and also the other officials within the health departments, but unfortunately they haven't gotten a response as to how this is going to be fixed. And due to the fact that there's understaffing at the hospital, patients have to wait at least 5 days if they want to have a surgery performed, which is something that the nurses and also the doctors are saying should not be happening. We also spoke to them about other issues such as security. They are saying that about 2 weeks ago, the community in KwaMashu, which is where the hospital is located in, blocked the main entrance to the hospital, saying that the people that have been hired to work at the hospital do not deserve those jobs because they were supposed to go to locals. So since then, the staff has been feeling as if there is not enough security at the hospital and that they're not safe. There's other issues when it comes to some people who were hired for certain positions being demoted without being told, and when they look at the paperwork and when they go to HR and demand answers, they can see that what they're doing at the hospital is not listed as the job they were hired for, and they haven't been paid enough. Nurses are also saying that they are working overtime, but they're not being paid for overtime work, which is something that is an issue for them. They are saying that there is burnout. Everyone at the hospital has been burned out because there's not enough staff to go around. We spoke to a nurse who shared some of their grievances. She, of course, wanted to remain anonymous because she's fearing that she will be victimized. She's saying that they've been trying to contact and also have engagements with the Department of Health, but unfortunately, they failed to come back to them. So they turned to the Public Servants Association, the union who represents them, and this is why they took a decision today to then stop working, down tools, and demand answers from the health department. When I spoke to the nurse a bit earlier on, this is what she had to say.
Patients are affected, especially in departments like theatre, because there are patients who are booked for operations. You'll find that when there's not enough staff, some of the lists have to be cancelled because there's not enough staff. But the reason why the staff is not here, people are tired. You find that the person is overworked the day before, then the next day they won't come to work, they are sick. Then the patients have to be cancelled. Then you find that a patient in the ward has been waiting for an operation maybe for 5 days, keep on coming to theatre, the list is not finished. Then that is when now they are asking the nurses not to take lunches because they are trying now to compensate and finish this list, and now it's overworking the staff.
Lethiwe, thank you so much for your time and joining us this afternoon. We will, of course, touch base with you much later. That's our reporter, Lethiwe Mdluli, talking to us live from KZN.